Hello, 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 Gutsy Women. How are we all today on this lovely Wednesday in May? Yes, the year's flying over. And today I have the pleasure of speaking to Dr. Alina Ismail, and she's going to tell you who she is, where she is, what she does in the world, and why she does what she does in the world. And she's a wonderful member of the Gutsy Women Collective already, so that's even better. So hello, Alina, how are you doing?
I'm good, thanks. Thanks, Dee, for inviting me to this live. Are you okay with the Facebook in the background? Like, because I'm getting also some notifications. Is that okay?
I can't hear those, so that's probably, yeah, it's probably okay.
Okay, cool.
So hopefully we won't get those coming up, but I can't hear them. Right, so can you just tell people who you are, where you are, and what is the story behind what you do? What lights you up?
So I'm a functional doctor, and currently I'm based in Melbourne. So I'm originally from Malaysia, but studied in Adelaide in Australia, and then went home and then came back here. Now my family's here with me in Melbourne, Australia. And how I got into this is I started off obviously with conventional medicine, went to medical school, did all that. And then I have three kids, and two of them are on the spectrum. And I found at that time, so this is like years ago, my daughter is now 26. Then my youngest is also on the spectrum. He's gonna turn 18. And my middle child, who's the neurotypical one, but has the middle child syndrome, which gives me the most grief. So I found that at that time I had no idea about autism. Like we never learned much about it at school. Maybe it was mentioned in passing. And so I did all my own research. And that led me to thinking about conventional medicine because I find that, hey, don't get me wrong, I still do conventional stuff. My practice is like 50-50. And I realized that if you got a heart attack, if you got a raging infection, if you got a broken bone in an accident, you need drugs, you need surgery, right? And that you can
Yes.
die, right? So for acute things, conventional medicine is really good, but it's more for chronic things. So with being on the spectrum, I found that conventional medicine was just patching the problem. It was like something like a pill for an ill, right? Although there was a medication, like she couldn't speak well, send her to a speech therapist. She couldn't, ride a bicycle, send her to a occupational therapist. That's what we call them here. And so I was like, there must be more. So that's what started me on looking for more answers to help my kids, my especially the two. And I stumbled across functional medicine. So first I came into functional medicine. It was with it's an organization in Australia called BioBalance, and then they bring in specialists from the US to teach us general practitioners. And so it was more about mental health, autism, behavioral disorders in kids, how your brain biochemistry works in these disorders, how the gut-brain connection is such a crucial thing, brain inflammation. So I'm there learning of this, and then there's other participants who are talking about P5P, which is like the active B6 and this and that. And I'm like, oh my God, such a big, crazy world out there that I had no idea of. So started off with autism, mental health, then went into more, I studied with the Institute of Functional Medicine. So looking at the whole range of what we can do, because the body is like a whole body, right? You don't just treat the brain, you don't just treat the gut, you treat the whole body. And then I started seeing parents of these autistic kids because they were run down, especially the moms, stress, fatigue. And then now I concentrate more on autoimmunity, especially the thyroid. The thyroid's my favorite subject. It's one of the root causes of fatigue, body aches, brain fog, but it's not well addressed in conventional medicine. So that's where I am at the moment.
Wow. So you've got a story behind what brought you here.
I find that, yep, sorry.
Oh, I was just going to say, when you actually started to look at that, what was it? Was it having your children on the spectrum that was the trigger for that, and the spark for that? And
Definitely.
where did it lead you? What did you actually discover from that
Then I
point?
could help my kids more. Like then we looked at nutrition, because I never learned about nutrition in medical school. And we look at gluten, dairy, how in some people it can trigger the immune system, it can cause lots of brain inflammation. So that's how I address. And then obviously there's supplements, but I'm not like a take supplements forever. You got to look at, food as medicine, right? You always go back to food, but at the start, if you might need it, yeah. So my daughter is more on the severe side. She's much better now. She's pretty independent. My son couldn't speak up till he was 4 years old. Now he's like verbal diarrhea. And I'm like, sometimes I want to say something and complain. I'm like, he never used to speak. So I'm happy. I'm really grateful that I stumbled into functional medicine. I've managed to help my kids. I've managed to help kids of other people, like patients of mine with kids on the spectrum. And then I've ventured out now to helping adults. I still do a lot of kids on the spectrum, but my goal, like my niche now is more women with fatigue, body aches, and brain fog. So that's my current niche.
Yes. So for people that don't understand the full meaning of being a functional medicine doctor, can you give a bit more in-depth detail about what that would look like if somebody came to see you?
Well, first of all, a diagnosis is just like a label. Like some people come to me and they say, "Oh, I got chronic fatigue." I said, "Okay, usually in conventional medicine, we like to label things based on symptoms, right? And then we do all these investigations. And then if they have no idea why you're fatigued, chronic fatigue syndrome is probably like a diagnosis of exclusion. So we don't know what's wrong with you. Everything seems to come back normal. Let's label you this." Because then I always ask back to the client. I say, "Okay, you've been diagnosed with chronic fatigue, and then what?" And then they're like, "Don't know. Nothing's been done," right? So then, and then I say, "Okay, how about your bloods?" Because we look at blood work from a functional point of view. So our levels. So imagine if in conventional medicine, when you look at the labs, reference ranges, say from 0 to 100, and normal is say 20 to 80 is normal. And then suddenly if you're 19 or you're 81, you've got disease, right? It's like you're either well, healthy, or you've got disease. Whereas in conventional medicine, we've got optimum ranges. So it's still within that healthy range, but it's a narrower, more optimum range. So that when it starts to get a bit out of the optimum range, then it's like red flags, right? So like, oh, we should monitor. You're probably at risk of this. So we try to look at things before it gets beyond help, so it's more prevention than cure. So blood work is huge in functional medicine. So when people say, "Oh, my doctor said," or "my practitioner said my bloods are normal," I say, "Can I have a copy?" And then let's look at it from a functional point of view. Because sometimes there's so many things you can pick up from a functional, like blood work, just normal bloods. You don't have to do those expensive tests like the poo test and the organic acids test. Sometimes you do, but you can just start off with blood work.
I actually did those expensive tests.
You can, but there is like a hierarchy. So usually start off with the blood work, unless it's you've done the blood, you've done the work on it, and then 3 months the line, you repeat your bloods and within the range, and you still feel unwell, then that's when you investigate further, right?
Yes.
Yeah.
That's it. And I didn't actually have the blood done. My doctor took a blood test, and I remember sitting in the surgery saying, "Okay, you're going to take a blood test and see what's happening here," because I've been, with chronic conditions for, the best part of 36, 7 years, something like that in my life. And so I remember sitting in the surgery and she said to me, we can do the blood test, but you know, the NHS blood tests, they're pretty underpowered. Now, what an admission from a GP to actually be honest enough to say that they're pretty underpowered. So they don't look in detail with, that was the message I was getting. They weren't looking in detail. It'll come back and it'll come back normal, like normal, they're normal. So it's, I think that was a real eye opener for me, that just really got me more and more into functional medicine, you know, the organic food, your supplementation, your minerals, all of that kind of thing. And so I totally hear what you're saying, that the blood tests from a functional medicine practitioner are wider.
Yeah.
And you can see more, and you can diagnose, or you can come to conclusions better because of you've got a bigger picture. It's not like you're just taking a snapshot. You've got a much bigger view of what's happening in somebody's body. Isn't that correct?
Yes. And it happens here too. In Australia, we're governed by Medicare, which is controlled by the politicians, right? So there are tests that, yes, the government won't pay, but we can, as doctors, we can organize private health, like private tests. So if the patient's willing to pay, then go for it, right? Because if not, we doctors also get into trouble because they audit us. And then if they think we are doing unnecessary tests, it's necessary, but it's coming from a different point of view. And then they think I'm wasting the government's money ordering unnecessary tests. So yeah, but we can get around away with that by doing it privately. The other thing is, do you know how we get those reference ranges from the labs?
No, but you're going to tell me, aren't you?
Yeah. For example, vitamin D, right? The reference range that the labs here say vitamin D is normal is above 50. And in functional medicine, my optimum range is about 120 to 150. That's a big gap, right?
Yeah.
So imagine someone goes to their doctor and they say, oh, your vitamin D 55, you're normal. But that's not optimum, right? And then they still feel tired when it's such an easy thing to address, right? Vitamin D, just get some supplements. You can't get it from food, so it's mostly supplements. And so how do they get this reference range? Say they take 1,000 people of the population. Ideally, they should take more, like 10,000, but the labs don't have time. So they take 10,000 people's bloods and say it's vitamin D. They plot the vitamin D on a graph. You get like a bell-shaped curve. And then they say, ooh, if 95% of the population their results fall in this bell shape, that must be normal, right? But we forget 95% of the population, of this 95% of the population, 60% have a chronic illness, 40% probably have at least 2 chronic illnesses. And then there's mental health problems, at least 30% of the population. So is that really the benchmark that we are looking at? Like we're comparing bloods of not like normal, healthy individuals, right? So that's why. And then I don't have it now, but I could show you how over the years, the vitamin D, for example, reference ranges keeps going lower. Keeps going lower and lower because everyone's vitamin D is low, especially in Australia. So then you get a new reference range and it's a lower one and a lower one when that's not optimum for what your body needs. So that's where the problem is. Whereas the reference range of functional ranges, they come from like studies that we do in a bigger cohort, bigger sample.
So what I'm hearing is that the range of normal is being lessened to fit a narrative. Is that right?
Yes. Yeah, because that's what most people are at the time, right? But they're not healthy people. So yeah,
No.
if we could get bloods from healthy people, then that would be a better reference range, but we don't.
Yeah. So in that respect, we when we get those tests back from a GP,
Yep.
and we should actually take it with a pinch of salt and then just up our vitamin D anyway.
You can. Some people worry about, oh my God, I'm gonna OD on D. Most of the time, you don't overdose on D.
No, you can't overdose.
And
You can't overdose on D.
but then there's like some people do go to the extreme, right? Because some people think the more the better. So I just had a patient recently, and yes, this like just today, and hers was 190. I'm like, okay, optimal is about 120 to 150. So yours is a bit too much. I said, how much are you taking? And she's doing 10,000 vitamin D a day. I say, I do have patients who are on 10,000 IU, but it's not all the time. It's not a forever thing.
Yes.
So I always like to test and, do something and then retest. You always have to measure, right? To be sure. Yeah. So, and then you're wasting money, right? Because then you just, yeah.
It's going down the toilet, isn't it?
I know, you're pooping it up. Yeah.
That's what I always say, if you're doing that, that's fine, but it's just the rest of it's just going down the toilet. You might as well just be throwing your money into the loo and flushing the chain.
Yeah. Another thing I forget is with the markers. So say like over here, zinc is not covered by Medicare.
Okay.
You have to pay for it. But zinc's so important, right? Zinc's important for your immune system, for mental health, for skin, hair, nails. So some people will pay for the zinc test, but if you don't, you can actually look at your markers, blood markers. Like sometimes your white cell count will be low, your ALP, alkaline phosphatase, will be high. So there are other markers that you can get from normal liver tests, normal full blood counts that you can use to then to gauge what your zinc is. So yeah, you don't always have to do the expensive blood tests. You can get away sometimes with just the normal blood markers. But before I forget, you must prepare your body when you do the bloods, right? So you can't just randomly do it at any time. You have to make sure you're fasting. Some people say they fast. Good if it's 8 hours, at least 8 hours, because that affects the sugar and the cholesterol. But some people fast too long, and then that will affect like your liver markers and your kidney markers, and then you're like, oh my God, there's something wrong, when it was just the way you prepared yourself before the bloods, right? So the usual things would be like fasting 8 to 10, make sure you're not exercising like crazy 3 days before, no alcohol for 3 days, supplements you might want to stop for 48 hours, and so on. So there's like a whole list of what's the best thing. And you need to make sure it's always like this every time you do bloods, right? And you always stick to one lab company, because different labs, different machines, different reference ranges, and then you're just comparing apples and pears.
Yes.
And a lot of people don't realize that.
Yes. It's really important, isn't it, for when people are shifting across from one mode of testing to another, that it's really important, because if we're going from the general, medical professionals who are testing there, and then you can't really compare that to what you do. So and then there's several, like you say, several labs will have different machinery and all of that. So it's really important for people to be aware that they're not going, oh, well, I'll just get a second opinion and then go somewhere else. Then you get completely confused.
Yeah.
It's the man with 2 watches never knows the time.
That's a good one. Never heard that one.
Yes, it's a good Japanese saying. The man
Is it
with,
Japanese?
I think the man with 2 watches never knows what time it is, because they're both saying something slightly different, so you never know. Just keep one. That's just my sense of humor coming in.
Oh, laughter is the best medicine. I always like to joke a lot.
It's a great analogy, isn't it? When we're thinking about something like this, is to go, just like you say, stick with one. So, Alina, can you help the women who in the group who have got maybe some chronic pain conditions around? It's a lot of your work around the mind as well, the mindset, and how that impacts the body. Do you do anything around that as well?
Oh, I have this thing called the pyramid of dysfunction. One of my mentors, we work with that. And imagine if it's, well, it's like a triangle, right? Like a pyramid. If you don't address the base, you could do everything else on top. The vitamin D numbers might come back normal. Some people come to me and they just want to address the thyroid. I say it's fine. But if the numbers are normal now, but you still feel like crap, then it's probably because you don't get the base right. And the four parts of the base is trauma. So if you've had emotional trauma in the past, now there's lots of talk about transgenerational trauma. It has to be addressed. If you got lots of stress, whether it's stress from your kids, your work, people around you, that has to be addressed. Because if not, you might get slightly better. You could be taking 10 different types of supplements, but if you don't address the mindset and it affects the rest of the body, then, things don't work. So that's huge. Sleep is another huge one, obviously, at the base of the pyramid, and upper gut. So upper gut is looking at more like stomach acid, because when you're stressed, sometimes you produce more stomach acid. Stomach acid, you do need it though for absorption of things like zinc, iron, B12. And yeah, so that's how I go about. And obviously, I'm not a psychologist. Sometimes if it's like really severe case, I always say to my patients, my clients, maybe it's time to refer out, maybe see someone that's specific in the area that can help you. I can support you with like some vagus nerve work, do more like things to distress. So like, things like, yeah, triggering the vagus nerve, humming, singing, all those things are really good things and simple to do. It's not rocket science. It's journaling is huge, gratitude, because sometimes we're just stressed, we forget about the simple joys in life. Like, yeah, yep. And if we could see the world from like a better point of view, like a more positive outlook, then psychosomatic, right? Sometimes when we're so stressed, it comes out as bodily symptoms. So yes, the mindset's very important.
Definitely. I always think that as well. And that's obviously my line of work, is the mind part of it, the emotional, psychological components to chronic illness. And it's wonderful that we're having so many wonderful professionals like yourself coming into the group, because then we can get to know each of you and be able to point people in different directions around where to go and who to actually, that we would recommend people go and have a word with. So thank you for being on the interview today, Alina. It's been wonderful speaking to you. And
Thanks
I just want to, are you welcome? You're so welcome. It's just been lovely to speak to you and actually get to know you, because it's great when we get people coming into the group, but it's even better when we can actually have a face-to-face conversation like this. It's not just a photograph in a group that, it's like,
yes,
who is this
true.
person? They look really nice, but who is this person? So yeah, that's really lovely. So thank you so much. Thank you to the audience watching and on replay. And if anything has resonated with you that Dr. Alina has said, then please comment below in the comments. I'm sure she'd be more than happy to answer any questions and connect with you. So please do that. And I will tag you in this video, Alina, and then you'll be able to come in and find it. And yeah, just connect with more and more people in the group. It'd be lovely. Okay. So
thank you.
So I just want to say goodbye to the audience, and we'll just end the live stream and we'll have a little chat. Thank you.